Okay. Hi, everyone. This is Connor, and I'm here with Diane, and we're going to record a mock interview using the new Qualtrics survey. We're going to do a mock case investigation interview. Are you ready to go, Diane?
Ready?
Okay, so the first page looks like this. You will need a MedSys ID, and we have a couple fake MedSys IDs for this mock interview video. Okay, so when I enter that in, I will need to type in my name as the interviewer. And then you can see that the patient information has been pre-populated. And this is an important date to pay attention to. So make sure that you have this somewhere because it will come up, the specimen collection date. I'm going to click confirmed case because I am not working on Ricardo's team. And then I'm going to click next. And you can see that I get to this next page that has the script for what to do when I actually make the call. So from now on, I'm going to dive in and pretend like I'm calling a real person. Okay, here we go. Ring, ring, ring.
Hello?
Hi, may I speak with Erica Plett, please?
Yeah, this is Erica.
Hi, Erica. My name is Connor Fitzgerald. I'm calling on behalf of the Arizona Department of Health Services to discuss some health information and ask you a few questions. How are you?
I'm still feeling a little tired, but other than that, I'm okay.
Okay, well, I'm sorry to hear that. Erica, could you verify your date of birth for me just so that I know I'm talking to the right person?
I'm not real comfortable with that. I don't know who you are. How do I know you're who you say you are?
Okay, I understand why you're concerned. And I do want you to feel confident that I am who I say I am, that I'm working for the Arizona Department of Health Services. So I could have you call my boss at ADHS, or sometimes what I'll do is I'll send people an email, my work email, so that you can see that I have a .gov email. Is that something that would work for you?
Yeah, that would probably work because I don't want to start calling at people.
Okay, yeah, that's understandable. I could send you the email right now. Do you have a way to check your email while you're on the phone with me?
Yeah, I can check my email on my phone.
Okay, fantastic. Um, what's a good email for you to, what's a good email for me to confirm with you at?
It's Erica, my name,
Mhm.
.123@gmail.com.
Okay, so Erica, spelled like your first name, .123 at
Yeah,
gmail.com.
yeah, that's right.
Okay, perfect. So I'm sending that email to you right now. Um, you'll see that it comes from a .gov email address, and I'm just going to put confirmation in the subject line and my signature in the body of the email. Okay, I just sent it to you, so you should get it in just a second. Let me know when you get it.
Okay, yeah, something just came across. What did you say your name was again?
Connor Fitzgerald.
Yeah, okay, that's from you. Okay, Connor.
Okay, thank you, Erica. Um, do you have time to talk with me right now?
Yes, I do.
Excuse me. You know what? I realized that I never verified your date of birth. Would you be so kind as to verify your date of birth just so I know I'm talking to the right person?
Yeah, my birthday is 2687.
Okay, thanks, Erica. So I'm calling because we received your test results indicating that you tested positive for COVID-19 on the 24th of August. We're trying to get a better idea of your symptoms, how long you've been sick, and to do what's called contact tracing to prevent the spread of the virus. All of your answers will be confidential. Do you have time to talk right now?
Yeah, I guess so. How long does it take?
It depends a little bit, but in my experience, usually between 20 and 40 minutes, but I can try to make it fast so that I don't waste a lot of your time.
Okay, that's okay, I guess.
Okay. Thank you so much, Erica. I appreciate you taking the time to talk with me today. The address that we have on file for you is 8 Mendota Parkway, Gore, Arizona 85030. Does that sound right?
Yes, that's right.
Okay. And do you currently live on tribal lands by any chance?
No, I just live in Gore.
Okay, thanks. Just needed to confirm that. So tell me what symptoms have you had with COVID-19, Erica?
Well, when I first got sick, I was running a fever and I had a cough and I would get short of breath with just doing any little thing. But now I'm a little better. My fever's gone and I'm not so short of breath.
Well, I'm glad to hear that. And I'm sorry that you weren't feeling well for a while there. That must have been hard.
You
If
know,
it's
I'm
okay,
still I'm still tired all the time.
okay. Yeah, that makes sense. If it's okay with you, would you mind if I mention some of the other common symptoms? And you can just tell me yes or no?
Okay.
Okay. Have you had a sore throat at any time with COVID-19?
Just when I was coughing so much.
Okay. And then you mentioned that you had shortness of breath. Would you say that you had difficulty breathing as well?
No, just when I was doing things.
Okay. Got it. Um, did you have the chills or shivering with that fever at all or any other time?
Just like the first 2 days when my fever was high.
Okay. Would you say both chills and shivering?
No, just chills. I just had to get under a bunch of blankets.
Okay. Got it. Have you had a headache at all?
No, not really.
Okay. Any muscle aches or sore muscles?
Well, yeah, I mean, I guess I was kind of like achy all over, kind of like when you have the flu.
Right. That makes sense. What about GI symptoms? Have you experienced any nausea, vomiting, or diarrhea?
No, none of those.
Okay. What about runny nose or cold-like symptoms?
No, that's what was weird. I was coughing, but I didn't have a runny nose or congestion or anything like that.
Okay. Any loss of taste or smell?
No, I don't have much of an appetite, but I can taste things.
Well, that's good. The last one is kind of a weird one. But have you had what they're calling COVID toes, which is a reddish blue discoloration of your hands or feet?
No, I'm pretty sure I would have noticed that.
Okay. Yeah, I bet you would have. Is there anything else you'd like to tell me about your illness?
No, I just would like it to be over with.
Yeah, I hear you there. When did you start feeling symptoms for the first time, Erica?
It was the Saturday right before I got my test.
Okay, so let's see. It looks like you got your test on the 24th of August. So does the 22nd of August sound right?
Yeah, because I got my test on a Monday because we didn't want to go on the weekend. We thought it would be too crowded.
Okay, got it. Um, with COVID-19, have you been diagnosed with pneumonia, clinical or radiologic?
No, I didn't go have an x-ray or anything. I just did a telehealth visit with my doctor.
Okay, and I know you just told me that you only had a telehealth visit, but I have to ask, were you diagnosed with acute respiratory distress syndrome, ARDS, by any chance?
No, definitely not.
Okay. And were you hospitalized overnight for this illness?
No.
Okay. Didn't think so, but just had to double check. So prior to getting COVID-19, um, I'm curious if you had any other health conditions. I'm going to list a few health conditions, and if you'd be so kind as to tell me yes or no.
Okay,
Okay, thanks. Um, do you have diabetes or obesity by any chance?
no,
Okay. What about cardiac heart disease other than high blood pressure or high blood pressure or hypertension?
well, I have a little bit of high blood pressure. I work in a stressful environment.
Okay. Thanks for sharing that with me. Do you have asthma or chronic lung disease such as COPD or emphysema by any chance?
No,
Okay. Any chronic kidney disease or chronic liver disease?
no,
Okay. What about cancer, current or previous of any kind?
no,
Okay. And we're almost done here, just a few more. Any other immune compromising conditions such as HIV, AIDS, Crohn's disease, lupus, organ transplant, autoimmune disease, or anything like that?
no,
Okay. Do you take any medications known to lower your immune system, such as chemotherapy or systemic steroids?
no.
Okay. And then finally, do you have seasonal allergies?
Doesn't everybody in Arizona?
I think so. Just about. Um, are you a current or former smoker, including vaping by any chance?
I used to smoke, but I quit about 2 years ago.
Okay. Thanks for sharing that. Now I'm going to ask you some questions about the 2 weeks before you develop symptoms. Um, so it can take anywhere from 2 to 14 days from the time you're exposed to the novel coronavirus to the time that you begin developing symptoms. So we're interested in this 2 week time period because it can sometimes give us a better idea of where you may have been exposed to the virus. Okay.
Okay.
So in the 14 days or 2 weeks before you started feeling ill, did you have close contact with someone who was positive for COVID-19 or sick with COVID-19 like symptoms, something like a fever, cough, or shortness of breath?
Well, I don't know for sure, but I probably did because I work in a long-term care facility.
Okay. Um, so was there anyone in particular who you noticed who had those symptoms?
Well, we've had a couple of our residents get admitted to the hospital.
Okay, got it. So in those 2 weeks before you started feeling ill, and actually I just wanted to kind of um, verify with you that we're talking about the right time. I don't think I made a note of this. Did you say that your symptoms started on Saturday the 22nd?
Yes.
Okay, that's what I thought. So we'd be talking about so going back to the 8th of August, just to specify. So during those 2 weeks, did you attend any gatherings with 10 or more people? Not including a workplace setting, but things like parties or protest rallies or faith-based events?
Well, we went to church that Sunday before I got sick.
Okay, so let me take a look. So again, if you started feeling symptoms on the 22nd, you said the Sunday before?
Yeah, because I didn't go when I was feeling sick.
Okay, so on August 16th, Sunday, August 16th, does that sound right?
Yeah, yeah. We
Okay.
went to church Sunday.
Okay, got it. And would you say that there were 10 or more people there?
Oh yeah, there was a lot more than 10 people there.
Okay, that's good to know. Thanks for sharing that with me. Okay, and what about the Sunday before that? Did you go
No,
to? Mhm.
no, I work every other weekend, so I couldn't go the Sunday before.
Okay, okay. So just one time. And if you ever hear silence on the line, I'm just typing in some of this information, just so you know that I haven't run off.
Okay, I hope you type better than I do.
I'm trying. I'm trying, but sometimes I'm a little slow. What's the name of the church that you go to?
It's St. Michael's Church.
Okay. And what's the address of St. Michael's or Cross Streets if you don't know the exact address?
Yeah, it's on the corner of 12th Street and Main.
Okay. Is that Main Street or Main Avenue or just Main?
I think it's Main Street.
Okay. Thanks for that. Is that in Gore where you live?
Yes.
You don't happen to know the zip there, do you?
Yeah, it's the same as my house. It's 85030.
Okay, perfect. Thanks for that. And that was on the 16th of August. Okay, so next we're going to ask you about some of your travel history and possible sources of your COVID-19 infection. So in the 2 weeks before you started feeling ill, did you travel within the US or within Arizona?
I don't know if you consider it travel, but we went up to see my sister in Payson.
Okay, so when did you go up there?
Um, it was, I think, that Saturday. Um, yeah, Saturday, the day before we went to church.
Okay, so August 15th.
Yeah, that sounds right because I worked the weekend before.
Okay, got it. Um, any other travel outside of the state of Arizona or outside
No,
of the country?
oh no,
Okay, so you didn't leave the country during the 2 weeks before you were feeling symptoms?
no.
Okay, just double checking. So now we're going to collect some basic information about you. And some of the questions will be similar to the questions that you see on forms when you go to the doctor's office, okay?
Okay,
What gender do you identify as?
I'm female.
Okay, and what's your ethnicity, non-Hispanic or Hispanic?
I'm non-Hispanic.
Okay, and then when you fill out forms and they ask you for your race, what do you select for race?
Um, I usually select white or Caucasian.
Okay, thanks for that. Are you currently pregnant by any chance, or were you pregnant during your illness?
No.
Okay. So going back to the 2 weeks before you started feeling sick, what was your occupational status during that time?
I was working.
Okay. So in order to detect outbreaks and protect the health of people who are at risk for developing severe outcomes from COVID-19, we have some questions about where you work, attend school, or volunteer. But we won't share your information with your employer without your permission, okay?
Okay.
Okay, so in the 2 weeks before you got sick, um, did you work or volunteer? And I know you just told me that you were working during the 2 weeks. Um, so sorry to repeat that, but in those 2 weeks before you got sick, did you work in any of the following fields? Did you work in a long-term care facility by any chance, including nursing home, skilled nursing facility, assisted living facility, long-term acute care hospital, or hospice?
Yeah, that's where I work. I work at Gore Valley Living Center.
Oh, okay. I'm going to list just a few others. I know you just told me where you work, but just to cross them off my list here. Did you happen to work as well during that time at a healthcare facility, including outpatient, clinical, or hospital?
No.
Okay. What about a facility serving a vulnerable population, including a rehabilitation center, a halfway house, a group home, a homeless shelter, a senior or adult daycare center?
No, our population is mainly long-term care.
Okay. Any work or volunteer at any school facilities, K through 12?
No,
Okay. Any other facilities serving children, including childcare or summer camp that you may have worked or volunteered at?
no,
Okay. And I'm almost done here. What about correctional facilities, including jail, prison, or juvenile corrections?
no,
Okay. Any governmental offices, including city, county, or state offices?
no,
Okay. What about a law enforcement facility?
no,
Okay.
no.
Anything else come to mind for volunteer work or work outside of the work you do at the long-term care facility?
No, we've been really busy, so that's pretty much taken up most of my time.
Okay, I bet. Okay. What's your job title there at the long-term care facility?
I'm a nurse.
Okay. And can you remind me of the name of the facility again? I know you already mentioned it, but
Yeah, it's Gore Valley Living Center.
okay. Do you have an address or cross streets for that facility?
Yeah, yeah, actually, the address is 1245
Hmm.
North Ninth Street.
Okay. Thank you for that. And I imagine that's in Gore.
Yes, that's in Gore.
And you don't happen to know the zip there, do you?
Yeah, everything in Gore is 85030.
That's convenient.
Yeah, it's a small town.
Okay. So when was the last time that you worked at the long-term care facility there in Gore? Did you work there at all during the 2 days before you started having symptoms, or any time thereafter?
No, because I was on vacation um, that week before I got sick.
Okay, well that was lucky. When was the last time that you physically went to work there?
Would have been that Thursday. Um, it was the Thursday before last week.
Before last week. So would that have been August 13th or
Yeah,
August 20th?
no, I was off that whole week before I got sick, so it would have been the 13th.
Okay, great. Just wanted to double check that. Thank you for sharing that with me. Did you happen to let your employer know about your positive test result?
Yeah, I called them because I told them that I couldn't, come back from vacation when I was supposed to.
Okay, thanks for letting them know about that. Um, would you be interested in a letter from us, a public health absence letter to excuse you from work due to having COVID-19?
Yeah, that would be really good because I don't have a lot of sick time left.
Okay, that's definitely something we can do for you. What's a good, actually, you know what? Is that erica.123@gmail.com a good email address for that letter?
Yeah, that would be great.
Okay. Just entering in your email. Just give me 1 second. Okay. Yeah, I'll send that to you as soon as I get off the phone today, okay?
Oh, thank you. I would appreciate that because that way they'll have to pay me, right?
You know, I'm not sure about that, but the letter does help some people with work absences.
Okay, good.
Okay, not too much more to go, just a few more questions. What's your current living situation, Erica? Are you in a house or an apartment, or do you live in a congregate setting? What's your living situation like?
I live in a house with my husband.
Okay, anybody else in the house with you? Any roommates or other family members?
Just the dogs.
Okay, we won't worry about the dogs today. So you said you live with your husband, just the two of you, correct?
Correct.
Okay. All right, just give me 1 second. So the next part of this survey is about following up on any symptoms that you and your household members might be having. Because we don't have a vaccine yet for COVID-19, recording current or newly developed symptoms is one of the only tools we have to prevent the spread of the virus in Arizona and ultimately save lives. So that's the reason why we're going to ask you about your household contacts and other contacts, um, even though I know that some of the questions are a little bit personal. Um, you and your household members will be asked to monitor themselves and report any symptoms of COVID-19 to public health for 14 days, okay? So this will be done using the state of Arizona's automated system. You'll just receive a reminder each day by email or text to record symptoms, all right? It's easy, it takes less than a minute to complete, and it only lasts for the duration of your recommended quarantine period. At the end of the quarantine, you'll be unenrolled from the system. You will not receive any additional correspondence, okay? So to record symptoms in the automated system each day, one person can answer for everyone in your household, just to make it really easy. Would you like to answer for your household, or would you like to designate your husband to do it?
Oh, I think I better do it.
Okay, I appreciate that, Erica. Okay, what's better for you, text or email?
I think I like text because I, can see it right away. I don't have to flip the screen.
Yeah, that makes sense, especially since some people don't check their email that frequently. Um, so um, let's see, the number, would a text be good at this number that I'm calling you at right now?
Yes, that would be perfect. That's my cell phone.
Okay, great. I'm just going to confirm that number to make sure it's right. 330-319-4968. Is that right?
Yep, that's correct.
Okay. And is this number a smartphone by any chance?
Yes, it's a smartphone.
Okay. And you connect to the internet with that phone?
Yes, that's how I got the email from you.
Okay, great. Well, that'll make it a little easier to fill out. Um, you'll fill it out through a link, and it'll just save you some time.
That's good.
Okay. So now that we know that your household contacts will be monitored, I'd just like to get a little bit more information. So you live there with your husband, is that correct?
That's
It's just the
correct.
two of you, okay. What's your husband's name?
His name is Troy.
Okay, and what's Troy's last name?
Platt, the same as mine.
Plett?
Yes.
Okay, just double checking. How old approximately is Troy?
Troy's 34.
Okay, thanks for that. Just give me 1 second, okay? I just want to look at a few dates. I really appreciate you having the patience to speak with me today, Erica. Big
No,
help.
no problem. I'm a nurse. I understand.
Yeah, I'm just looking at a few dates that I'm going to share with you at the end of the call that will be important to keep track of, okay? Okay. And is Troy experiencing any symptoms right now?
No, he's fine.
Okay, that's good. Really glad that he's not feeling sick. Okay, so we have everybody in your household covered. So the last questions that I have for you um, are about any other close contacts that you've had. So we're looking at the time that you were infectious, right? The time that you were able to spread the virus. and that starts 2 days before your symptoms, and goes for 10 days from there. So in your case, since you started feeling symptoms on August 22nd, the period of time that I'd just be a little bit concerned about would be in between the 20th of August and today. Okay.
Oh, okay.
For these questions now. So have you been in close contact with anybody during that time period? And what I mean by close contact is just anyone who you may have been within 6 feet of for more than 15 minutes. And that includes if you're wearing a mask.
Yeah, actually, I was just thinking about that. And of course, I didn't know I was going to get sick. And so, since I was off that week, I went and had lunch. We were outdoors sitting outdoors, but I went and had lunch with a friend of mine the day before I got sick because we hadn't been able to get together for a while. So we met and we had lunch outdoors, and we were wearing our masks, except, of course, not while we were eating.
Okay, yeah, well, that makes sense. Was that on that Friday before you started feeling symptoms on August 21st?
Yeah, yeah, because it was the end of my week's vacation.
Okay, got it. Thanks for sharing that. Anybody else that comes to mind that you may have been in contact with during
No,
the time period I just mentioned?
no, because once I started feeling sick, I knew I shouldn't be going around other people.
Okay, no neighbors or any family members stop by unexpected.
No, my one neighbor asked if she could do anything, and I told her no, I didn't want her coming in the house. She dropped off a banana bread outside the door and texted me to tell me it was there, but she
Oh,
didn't come in the house.
well, that was sweet of her. We won't worry about her since she wasn't around for since she didn't come in the house. Okay, so what's your friend's name? The one who you had lunch with that Friday before you started feeling symptoms?
Her name is Sue Lowell.
Lowell.
Yes.
Okay. And do you have a phone number for Sue? And just to
Y-
clarify, if somebody reaches out to Sue, um, they won't mention any of your information. They won't even have access to your name. They'll just tell Sue that she may have been exposed to COVID-19 and give her some advice.
oh, okay. Well, she knows I got sick, so I think it's okay.
We'd still like to reach out to her just to do our due diligence. Um, I appreciate that you've let her know. And in fact, I was going to say to you that even though public health will be reaching out to your contacts, we do recommend that you notify any close contacts of your test results so that they can limit their exposure to others. Your name won't be shared with any of your contacts. So for each individual, I'm just going to ask a little bit of that information. So I appreciate that you reached out to her, but we'd still like to be in contact with her just to make sure she's doing okay.
Okay, is it okay if I tell her you're going to do that?
Yeah, you can let her know. That's not a problem.
Okay.
Do you have a phone number for Sue?
Yeah, Sue's phone number is 330-319-5679.
Mhm. Okay, so just to confirm, 330-319-5679.
Yes,
Okay. Does Sue live in Gore as well?
yes.
Okay. Give me just 1 second while I look at these dates. So you said that that was that Friday. Okay. All right. Is Sue what's Sue's preferred language?
Oh, she speaks English.
Okay, got it. Okay, so I'm just about done, but I do have a few really important dates to give you, Erica. Do you have a pen or a pencil to jot these dates down?
Yeah,
Okay, let me know when you have your pen.
yeah. I have a pen. I'm just sitting right here on the couch, and I keep a pen and paper next to me in case somebody calls on the phone and I need to write down any information.
Oh, great. Okay, so the first date that I have for you is September 1st. Okay, that's when your isolation period ends, Erica. So between now and September 1st, you should stay as isolated as you can from your husband, first off, okay? Since your husband doesn't have symptoms, I really don't want him to potentially get COVID-19 as well. So if you can isolate in the house from him, that will really help him to prevent from getting the virus as well. Does that sound like a possibility? Do you have space in your house to be in a separate room and to maybe use a separate bathroom? And if so, how would you go about doing that?
Well, we've been kind of trying to do that already. We have two bedrooms, so he's been staying in the what we call the guest bedroom. And it doesn't have a full bathroom. It just has, like a toilet and sink. So he does have to come through my room when he showers. But I try to be in the other room when he's going to do that. And we've both been wearing our masks.
Okay, great. Um, is there any way that you can wipe down the bathroom before he goes into shower? I know you weren't feeling well before, but if you're feeling a little bit better, is there any way that you could wipe that bathroom down with bleach or alcohol before he goes in there?
Yeah, that's not a problem. Usually we wash the bathroom down with Clorox, when we clean it. So I don't think that's a problem.
Okay, great. Well, it sounds like you guys are doing a really good job, and I know it's not easy, but Erica, if you can really keep up that isolation, staying away from him and not being in the same room, not eating together, um, until the end of September 1st, that will really help him from getting the virus, okay?
Yeah,
Also, during yeah, what were
he
you gonna
he
say?
he he's even been eating in that guest bedroom, you
Okay,
know,
good.
because I eat in the kitchen.
Good. Okay. And during that same time period, in addition to staying isolated from your husband, you should stay at home, not see other people, and not go to work, okay, to prevent the spread of the virus.
Yeah, well, as long as you'll give me a note for work, I should be okay with that.
Okay, great. So I'm going to put September 1st on that letter that I'm going to email you. And that means that as of September 2nd, as long as you're feeling better and as long as you don't have a fever, you should be good to go back to work on September 2nd. Okay.
Okay.
Okay. If you are experiencing, a fever on September 2nd, you should wait for 24 hours. You should be 24 hours fever free before coming out of isolation, okay? And that's without taking any fever reducing medication.
Okay.
Okay, so the next date that I have for you is actually for your husband. It's September 15th, okay? So September 15th is when your husband's quarantine period ends. And what I mean by quarantine period is um, because your husband could potentially get the virus from you through the end of September 1st, it can take up to 2 weeks for people to develop symptoms after their exposure. So, to ensure that he doesn't have the virus and that he's not spreading it to other people, he should stay at home, not go to work, and not see other people until the end of September 15th.
Well, my husband's basically been working at home, but sometimes he does have to go into the office, like for a meeting or something. So, can you give him a note that says that he shouldn't go into the office?
I'd be happy to. Yeah, that's not a problem at all. And so I'll put September 15th on his note, which is the end of his quarantine period, okay?
Okay, yeah, because he doesn't need to like be off of work that whole time, but he just you're saying he shouldn't go into the office, right?
He should not go into the office. He can definitely work from home if he's teleworking. That shouldn't be a problem at all. Okay. The other thing to know is that quarantine is different than isolation because as of September 2nd, as long as you're not experiencing a fever, you two can be together for the rest of his quarantine period. Okay, Erica?
Oh, okay, that's good. And I, I guess I'll have to be the one like to go get groceries, right?
Yes, I'm really glad that you asked me about that. Um, you should be the one to go to get groceries, but not until the end of your isolation period, right?
Right.
So when did what just so that I know that I explained myself well, when did I say that your isolation period ends?
Well, you said I could go back to work on September 2nd.
That's right. So you could also go to the store starting on September 2nd. Up until September 2nd, you and your husband will have to figure out some kind of way to get groceries delivered to your house or to have someone drop them off. And I know that's not easy. Does that sound like something that's feasible? Do you think you could come up with a plan to do that? And if so, what would that plan look like?
Yeah, I think so because, like I said, our neighbors are really good. And I think if we went ahead and ordered the groceries, and paid for them online, when our neighbor goes to the store, she could pick up our order.
Okay, wonderful. And just make sure that your neighbor doesn't come into the house, that she leaves those groceries outside, okay? And just rings the doorbell and gets out of there.
Okay, yeah, or I can have her text me when she leaves them there.
Okay, that sounds great. And I know that's not going to be easy, but if you're able to follow that guidance, it will really help to prevent the
Yeah.
spread of the virus, okay?
Well, she's a
Okay,
really good neighbor. She'll help me.
that's excellent. So the last date that I have for you, Erica, is September 4th. Um, your friend who you had lunch with the day before you started feeling symptoms,
Yeah, Sue.
yeah, Sue. Sue should stay in isolation until September 4th, okay? Excuse me, you should stay in quarantine um, until um, September 4th to prevent the spread of the virus, okay?
Okay, but like her husband can go get her groceries, right?
Well, I don't have, I don't, yeah, that should be okay. Someone will reach out to her, okay? Um, but if you happen to talk to her, just let her know that the recommendation is that she stays in quarantine until September 4th.
Okay, yeah, I talk to her a lot. We talk on the phone.
Okay, wonderful. Okay, just give me 1 second. Okay, just a couple other just general public health messages. Just remember that anyone experiencing symptoms should stay at home and away from other household members as much as possible. So, anyone like yourself, right? Household members should stay home and monitor for symptoms. We suggest you notify anyone else you've had contact with of your positive test result. And please remember that everyone should be washing their hands frequently with soap and water for at least 20 seconds, or using an alcohol based sanitizer and wearing cloth face coverings. Okay. We
Yeah,
also
we
have
do,
a,
we do that.
oh, that's great. I'm glad to hear that. Um, Especially when you come out of isolation there on September 2nd, if you're not running a fever, Erica, and you go to the store, just make sure you're wearing a face covering at the store.
Okay,
We
yeah,
also,
we always wear masks.
that's wonderful. We also have a team dedicated to providing additional services such as housing assistance, financial assistance, and mental health resources, as well as shelter services. After our call, you can dial 211 or visit 211arizona.org for additional assistance, okay?
Okay, yeah, I think we'll be okay.
Okay, I'm glad to hear that, but don't hesitate to reach out to 211 if you have any questions or need any assistance.
Okay,
Um,
thanks.
Thank you, Erica, so much for sharing your information with me today. Do you have any other questions or anything else that you'd like to ask me about?
No, I don't think so.
Okay, well, thank you so much for your time today, and I'll send those letters to you as soon as I get off the phone with you, okay?
Okay, thank you. I'll be looking for that.
Okay. Take care, Erica.
Thank you.
Okay, and so I will need to send those letters out. Um, and I got that email copied down. So I usually put that email in my email so that it's ready to go. And then I put those together when I get off the phone. Okay. So all right. So that will do it. Anything else, Diane, that you want to mention before we stop the recording?
Uh, no, actually, I would like to mention that, Connor verified things with me on numerous occasions throughout the call. And that does two things to the person that you're calling for. One, it lets them know that you hear what they're saying, but also sometimes things aren't spelled the way you think they're spelled. And so verifying spelling and dates is really, really important.
Okay. Well, thanks for that addition, Diane. Um, Pleasure mock interviewing with you.
Pleasure mock interviewing with you.
All right.